advocate for changes in the law, changes in policy to make life better for immigrants, basically. So we work on a number of different kinds of issues, immigration policy, but also things at a more local level, like education in public schools, healthcare access, housing policies for low-income communities, and you know, issues like that that affect our constituents.
We've lost 6 attorney positions since the recession started. We've had to redistribute the work of attorneys we've lost to other staff members. They're working harder than ever before. We eliminated a number of, for example, the agency's pension contribution to staff. This year we didn't have a COLA, a cost of living increase. So I think that all workers in this country have been affected negatively, including those of us who work in nonprofit organizations. And it's actually just been really frightening. We're worried about having enough money to keep our services going the way they've gone, and to be faced with greater need, more demand for our services at a time when we have fewer service providers. That makes for a very difficult situation.
I feel like for emergencies you can treat everyone, but far as other health services, we can't just give health services over to anybody, and then you have people here that's working, paying taxes that can't get it. Because we know a lot of our illegal immigrants are not paying taxes because they're working off the books.
Would you feel more comfortable that way? Like, if you pay taxes, then you can get
Yes, I would. I would.
I think the problem is that non-taxpayers are using up the resources. I think the problem is that the resources are being allotted wrong, and that too many of our taxes are going to pay for things that really aren't serving us. Like, for instance, the military, you know, or bank bailouts. I think if money instead were going to social services to help society be a better place to live for everybody, I would be much happier as a taxpayer. And just as, I mean, as it happens, I have kids who went to public school, but if I didn't have children, I would still want my taxes to support public school, because it makes a better society for me that everyone growing up is getting educated. And similarly, it makes a better society for me if everybody who's sick can get medical care, even if I'm not the one using it. So I think that as a whole, for the best of everybody in the United States, everyone living here should have medical care.
In 1986, when there was a mayor coach here in New York, that was the new anti-immigration law that every illegal immigrant, which will be caught by police or any hospital, wherever they find him, they have to bring it to immigration services. Okay, so people didn't use it, they didn't go to the doctors, they didn't go to hospitals if they get sick. What happened? The New York was on the verge of epidemic, because those people were hide from being scared to be deported or something like that. And actually there was high level of sick people, not only immigrants but regular citizens or legal immigrants, because the sick people go between healthy people, make them sick, and so on and so on and so on. So Mayor Koch said, okay, enough is enough. So he forbid police and hospitals report illegal immigrants to the immigration authorities. This way he simply prevent epidemic. But anyway, even though the law was made it, there was hunt for illegal immigrants. They were gonna be here, they will be here. They were here, they are here, they will be here.
Putting water in the desert is not breaking the law, because it could be anybody could drink it. You're not just, I mean, if you want to help people, I really think that the situation with regard to illegal immigration crossing the desert is so bad that I think you almost have an obligation to break the law, to help people.